welcome to the Healthy Woman Podcast with your host, Payton McWilliams, physical therapist with a passion for treating women throughout all chapters of their life. Join me as I share about breast cancer recovery, pelvic and peripartum health, and fun topics related to women's lifestyle. I want to tell you about my favorite products, teach you some things, answer your questions, and talk all the things. Please remember that the content in this podcast is intended for general information only and should not be considered medical advice, diagnosis, or treatment. Please discuss with your healthcare provider if you have any questions pertaining to your health or situation. I'm excited to start this journey with you, so let's get started. Hello everyone, welcome to the first official episode of the Healthy Woman Podcast. Today's episode is why breast cancer patients should see a physical therapist. As a PT, obviously I am partial to breast cancer patients getting a referral for physical therapy, but I do think in all seriousness there is a lot of benefit to breast cancer patients seeing a physical therapist, even if they don't realize they have an impairment or a reason to need a physical therapist. There's a lot of things that breast cancer patients may not realize that is going on with them, or that may go on with them in the future regarding side effects of their treatment, that a physical therapist can be really beneficial for just educating them on and bringing to light. But today we'll discuss some of the reasons why patients who are undergoing breast cancer treatment should see a PT, as well as what breast cancer treatment entails, side effects of treatment, and how PT can be helpful. Okay, so first up, what does breast cancer treatment include? So many of y'all may not know what exactly people go through when they say they're going through breast cancer treatment. So normally what happens, you find a lump, or you go to your gyno and they find a lump and they say, okay, you need to get a mammogram, or maybe you're going in for your annual mammogram, whatever reason. Something comes up abnormal on your mammogram that sparks referral for an oncologist or someone on the breast cancer team. So then you meet with a team of a few different doctors and they figure out what kind of cancer, what kind of hormones does it respond to, is it best to do chemo first, surgery first, radiation, hormone therapy. There's all kinds of interventions they can do, and they generally pick whatever is the most necessary to kill the cancer the fastest, depending on the severity of the cancer, right? So I'm not a breast cancer doctor by any means, but I work very closely with them, so I have an idea of what is going on. So regardless, I'll just give you an example of what I see the most often. So patient gets diagnosed with breast cancer, maybe it's stage 1 or stage 2. They go through a round of chemo to try to kill some of the cancer and shrink it. And then they'll have surgery for that cancer. So if it's a tumor, like an actual mass, they may do surgery to remove the tumor. They usually try to remove margins. So from my understanding, again, I am not a surgeon, but that means going in to remove the margins, literally, of the tumor to make sure that there is no extra growth from the tumor that they may have missed during imaging. So hopefully, you only have one surgery. Sometimes that entails 2 surgeries, though. So 1 surgery for the tumor, 1 for the margins, if they don't get them the way that they want to the first time. So now we have chemo and possibly 2 surgeries, right? At this point, depending on what kind of surgery, you can have a lumpectomy, which is just a piece of your breast, or you could have a mastectomy, which is the whole breast, which is much more invasive, as you can imagine. Depending on what surgery you have, then maybe you go for radiation also. The radiation is there to kill any remaining cancer, right? So you do chemo to try to kill it, try to stop it, shrink it maybe. You do surgery to remove it, and then if there's anything left over, they do radiation to try and make sure that they kill everything possible. And with radiation, there is some side effects to the lymph nodes around the breast. For those who may not be familiar, you have your breast, and near the breast on the lateral side are the lymph nodes that go into your lymphatic system. Those nodes can easily be impacted by the breast cancer, unfortunately. This is why you hear many people who undergo breast cancer surgery also undergo a sentinel lymph node biopsy. This just means that they take 1 or 2 of those lymph nodes, essentially like the gatekeeper lymph nodes, you can say, and they test them to make sure that there is no cancer in them. If they come back negative, all is clear, and at least, they can say that they tested the lymph nodes and made sure that it did not spread to the lymph system. So they take 1 or 2 of those lymph nodes, during your surgery, and then regardless, they usually do radiation therapy. Now, this is where things kind of get complicated. The radiation can damage the lymph nodes. It can also damage the skin. It can cause something many people refer to as radiation fibrosis, which is just a thickening and a toughening of the skin. But radiation therapy in general is pretty aggressive. It's not a fun time. Some people don't have any side effects to the radiation, and some people respond really badly to the radiation. But that's pretty much your standard setup for breast cancer treatment as far as I've seen. So chemo, surgery of some sort, maybe 1, maybe 2, radiation. And then after that, if there's anything left over or for whatever reason to maintain, the doctors usually do some type of hormone therapy, whether that is a infusion, sometimes it's a pill, sometimes there's a chemo pill that you keep taking. And that's all just for someone who doesn't have a reconstruction. So now let's take that same patient case that we just discussed and consider someone who wants to have a reconstruction. They want their breast to look normal or like their other breast. That is a whole other surgery and a whole other process where somewhere in between chemo, radiation, or wherever you are in that process, you have a spacer put into your chest wall. It goes under your skin and actually attaches to your ribs. It's not pleasant from what I hear. Anyway, they literally attach this thing to your rib cage under your skin on the affected side, and they will inject it and fill it to literally expand and stretch the skin in increments every week or every 2 weeks, so that you can essentially save the skin. And then later on, when you finish radiation or you finish your treatment, they fill it with the fake breast. So that's a whole other surgery and a whole other recovery process separate from just the cancer treatment. So as you can see, there's plenty of room along that timeline for fatigue, strength deficits, range of motion deficits, tightness, pain, just anything really to go wrong and to benefit from physical therapy, which is why I'm such a strong advocate for patients at any point in that process to come to physical therapy. What I have not mentioned yet is the possibility of lymphedema. So lymphedema, I think, is the biggest problem in the breast cancer world at the moment, and is something that probably does not get enough attention as it should. The problem with lymphedema is that with any damage to the lymphatic system, which includes chemotherapy, hormone therapy, radiation therapy, surgery, any of those processes throughout the breast cancer treatment can unfortunately damage the lymphatic system. We'll get into that later in more depth on another episode, because I can talk a long time about the lymphatic system. But the point is, the lymphatic system is getting damaged throughout breast cancer treatment. And with that becomes a new problem area where we as people outside of the body do not know what the new essentially tap out level is for that patient's lymphatic system. So at any given moment, we are toggling on the edge of, are we going to overload their system and cause swelling and lymphedema and other lymphatic related problems? Or are we safe and their body is actually okay to continue bearing the load of their lymphatic system? We have no idea on the outside of that person's body what that tolerance level is. We know that radiation and chemo and surgery damage the system. We don't know to what extent. So this is why I push so hard for patients to at least get one physical therapy evaluation in during their treatment, so they can learn what the possible side effects, red flags, and symptoms are, whether that's lymphedema, pain, swelling, strength deficits, range of motion deficits. They can learn what the possibilities are, and as soon as they start to see changes, they know they can go to PT to reverse it and maintain their strength and their health. So outside the basic side effects of breast cancer treatment, like strength deficits or range of motion deficits or, fatigue from the chemo, there are plenty of other side effects that do not get enough attention that can also greatly benefit from physical therapy. So this is from the breastcancer.org website. Abdominal pain, allergic reactions, armpit discomfort, axillary web syndrome or cording, back pain, bone and joint problems, chest pain, constipation, depression, diarrhea, endometrial cancer and endometriosis, fertility issues, headaches, high blood pressure, insomnia, leg cramps, loss of libido, lymphedema, we've discussed that one, memory loss is a big one, mood swings, muscle pain, myalgia, neuropathies, that's a big one with chemo in particular, numbness, tingling. You can have scar tissue formation, seromas, which is like a fluid buildup. It's kind of like a cyst, but not really. You can get skin sensitivity. You can have swelling not related to lymphedema. You can have urine and vaginal changes and problems, vaginal dryness, vomiting, weakness, and weight changes. So that is not the entire list, but a very lengthy one that I provided you. And many of those you may even think to yourself, like, I don't understand how physical therapy is going to help with vaginal dryness or with constipation, but you'd be surprised at just what the field of physical therapy is able to do. So all of those things that I've listed out can actually be treated with physical therapy to some degree. And again, is 100% worth at least seeing a physical therapist for an evaluation during breast cancer treatment or after breast cancer treatment, if any of those apply to you or someone that you know. We can discuss those in more detail at later episodes, but I just wanted to give you guys the information and the resources to start questioning. If you or a loved one that you know is going through breast cancer treatment, ask the doctor for a referral. Just say, hey, I think that physical therapy may be able to help me with some of these symptoms, or I heard that physical therapy may be able to help me with my fatigue or with my strength, or I'm worried about returning to work and the possibility of swelling or lymphedema. And I really just can't imagine any doctor that would say no to a physical therapy referral, especially if a patient asks going through breast cancer treatment. There's just so much that they know physical therapy can do to help. So I can't imagine them saying no. If you're wondering who in particular to go to for rehab following breast cancer treatment, a PT, physical therapist, or an OT, occupational therapist, both would be really beneficial, particularly a PT or OT who is a certified lymphedema therapist. That means that they have the letters CLT after their initials. So for instance, for me, it's Payton McWilliams, PT, DPT, CLT. I will say sometimes it is challenging to find a CLT in your area. So just finding a breast cancer related physical therapist or occupational therapist who has experience with treating patients with cancer or breast cancer in particular would be ideal. Usually hospital systems that treat breast cancer have a physical therapist on staff that works in the hospital with breast cancer patients, and they will know a place that you can safely go to for physical therapy or rehab services, particular to your breast cancer related recovery. I've also attached 2 resources to the National Lymphedema Network and the Academy of Lymphatic Studies. They both have search engines to find a CLT in your area. If you guys have any other comments or questions or concerns regarding breast cancer rehab in the physical therapy realm, feel free to comment on the post below. I'm happy to answer any questions and respond. I'll try my best to respond to everyone. And I'm excited for episode 2. We're going to be talking about specifically lymphedema following breast cancer related treatment. So stay tuned for episode 2 coming out later this week. I'm Payton, and this is the Healthy Woman Podcast. Thanks for listening.